slide shows the two issues I'm hoping to cover. Self-cutting, a very modern epidemic, and an ancient Buddhist meditation technique, mindfulness, that's come bubbling up through psychiatry, psychology, schools, and this is not what I'm talking about. This is a very happy man in public, and it's a religious ritual once a year in Malaysia. This couldn't be more different than a lonely, isolated 10-year-old in their bedroom taking a razor blade to their arm, or very often it's somewhere not as obvious, it's hidden, using the abdomen or the feet. So the issue of self-harm by cutting, as I say, it's a modern epidemic, and I'm trying to address the use of parts of mindfulness from Buddhist meditations. Just a very brief attempt at explaining mindfulness. It's being in the moment, the now of Eckhart Tolle. One woman, a mother of a teenager who'd been cutting herself for several months, possibly years, and it only came to light when the girl got an infected foot. So it was out of sight. And she described this phenomenon as very much the new anorexia. I used to see it in psychiatry and psychiatric hospitals. It used to be common in prisons, but now it's very much an issue with school children, teenagers, housewives, all stages of life, even sometimes continuing into old age. And these are National Health Service figures. Last year, 18,000 girls and 4,500 boys were treated in A&E departments for deliberate self-harm. That covers a multitude of other harms, not just the self-cutting. But it's very much on the increase. Many of the charities like Childline, Mind, selfharm.co.uk have found a huge increase. And it's not just the numbers, but the fact that children are actually getting younger, as young as 9 or 10. It's always, I think, helpful, rather than generalizing, to talk about particular people. Joy was a patient I met my very first week as a junior doctor in psychiatry, and she had taken a craft knife to her arm, cut herself badly enough to need stitches. And after I'd done the suturing, I rang the consultant, because I hadn't a clue what to do. And he said, "You must discharge her immediately. She's attention-seeking, manipulative, bad behavior, don't encourage it. No sympathy, just get her out." She was beautifully made up, almost like a mask. And later on, I did see her regularly as an outpatient, and she was suffering from depression and did very well with antidepressants. But it was quite an eye-opener to me, and it made me feel, I think, quite passionately about this issue of self-harm, and shocked at the attitudes of my own profession. Many years later, I came across another lady I've called Joy too. She'd been trapped in a car crash, and following that, had a depressive illness. During the depression, she had flashbacks of childhood abuse. She went into trance-like states where she seemed very detached and almost in another world of her own. And in these, she cut herself with anything available. This was in a private hospital. One would have expected more enlightened attitudes, and it was some 30 years after my first experience with Joy 1. But again, the staff labelled this lady attention-seeking, manipulative, and week after week I had deputations of staff coming and saying, "Get her out, we can't cope." But she was very vulnerable, Luckily, we had an excellent psychologist that used a whole gamut of different psychological approaches. And this lady recovered. She married, she had a baby, and about 5 years afterwards, she trained as a therapist, and she became a very caring and valuable therapist. Another patient I called Carla, I'd known her mum. Her mum had been in and out with depression, also had diabetes, and so she was frequently in hospital. And Carla was unfortunately abused as a child by a male relative. As a teenager, which was when I first met Carla, and it was again very sad because she was 17, she was admitted to an adult female psychiatric ward. And you can imagine how good that was for her. She had had a history of alcohol abuse, setting fire, she'd been on probation for the arson, and of cutting herself. And again, I often had deputations of staff coming and complaining, not so much for just discharging her, but getting her into another kind of facility, because they said she's so difficult to cope with. She was often much worse if someone showed her affection. And I think that's one of the difficulties. It's one of the tightropes we walk in treatment. If you're too remote and detached, they can react by cutting. If you show affection, and some of the nurses did, I remember a Mediterranean nurse with a very Mediterranean personality gave Carla a hug one day, and immediately Carla got up, went and cut herself, because she couldn't trust affection. Affection reminded her of the abuse. So it's that fine line between caring, but not getting too close, or not getting too close too quickly. And Carla, I'm pleased to say, made an excellent recovery, again with a combination of medication, psychological help, and in recovery, and she still keeps in touch with me many years later. She has written some very beautiful poetry. And it's one of the things that I've found about many of these young people is that they are sensitive. That's probably why the problem happens. But they are creative individuals. If we don't help them, problems can continue into adulthood. There are all kinds of complications, effect on career. I've known people get turned down for jobs because of scars on their arms. So we need to help them. Latest report from the Royal College of Psychiatrists just last month, it's about the use of mindfulness in schools. That would be very good in prevention. I think in treatments, we have to be very careful. It shouldn't be just a single use of mindfulness, but it should be part of a treatment package. A list of some easy read books that do address the issue. Thank you very much.